should be doing in the fight against the gender disparities in our society. As an accounting officer, it has been my mission that whatever we do with our money, we must make sure that the woman power is part of the cake in the expenditure. And that is the only way we can begin to strengthen the economic empowerment of women as we fight these gender disparities in our country. The research unit has ensured throughout our work in making sure that the government messaging is evidence-based through our research. When the COVID-19 virus was declared a global pandemic, GCIS was tasked to lead the communication workstream of government. I remember that our first assignment at the beginning of 2020 was preparing communities for the receiving of the students that will be arriving from Wuhan, where the COVID started. This was followed by an announcement of the first case of COVID-19 in March 2020 and the subsequent spread of the new infections. GCIS was able to drive this campaign by working with various partners within government departments, in particular the Department of Health, the National Institute of Communicable Diseases, businesses, civil society, and members of the media. Today, we look back on the good work that was done by all South Africans, because if one recalls, when the first announcement was made that we needed to start getting South Africans to wear masks, a lot of us were very skeptical that will South Africans do their part? And true to what we saw during the period, every second person you met in either in the mall or in the taxis or in town, they were wearing their mask. So on this day, as we reflect, I think we do need to pay tribute to the South Africans that heeded to the message as we disseminated the message. One has to also give credit to our members of the media who also joined the work that we needed to do. And during this period, one has to give them the credit that they did minimize sensationalizing stories on this matter. There was an appreciation of the seriousness of what needed to be done at that particular time. They became dependable allies in their platforms in making sure that the message on how to prevent the infections was disseminated to their respective readers or viewers. Communication during COVID-19 demanded that we quickly adapt and adjust our messaging according to our audiences and infuse new information as it was becoming available regularly. Research became an important driver of this campaign. The research findings allowed us to adjust our message in accordance with the audience we were targeting. We were able to provide communities with information in the relevant platforms and relevant languages. We were able to empower them with information to allow them to take their own decisions on this virus. The targeted approach resulted in a better recall of our messages by the public. Collaboration ensured we managed to stretch our limited resources. We were all winners. The retail stores were able to use the content in their particular malls and their particular customers. The churches were able to use the content for their congregation. The NGOs were able to use the information for their respective communities. And yes, all of us today, we look back and we say the partnership that we forged at the beginning of 2020 has made sure that our country today is where it is in as far as the number of infections. The power of partnerships and collaboration will be today demonstrated by the findings from the Closed Research report that will be shared with all of us today. The findings of the Ask Africa research in partnership with GCIS provides an analysis of conversations with South Africans across the country about the pandemics. Such conversations have been transformed, could be transformed into knowledge, which we will be using going forward. Ladies and gentlemen, allow me as I conclude to say that the knowledge sharing sessions such as these, which we tend to have them quite regularly, but today we have spread and invited as many people as possible because this was a partnership, and this will enable us to learn from each other and also to benefit from the subject experts. We believe from our side as GCIS, these findings will assist in contributing to our work in communication beyond the COVID-19. At this point, Chairperson, allow me to welcome our panelist, the CEO of Ask Africa, Ms. Andre Rademir, who is also the CEO of a company that was started by a one woman, and we continue to partner with Ask Africa, and hopefully going beyond, we will continue. And we also have a panelist from Solidarity Fund who also were a partner as we navigated through the messaging and partnered with us in some of the research. And today we have, I think it's Tandega, it was meant to be Wendy Tlow, but I think she will correct me because the representative from Solidarity Fund is Tandega. I trust today's presentation will be helpful to a number of us as we listen to the presentation. And thank you very much, Program Director.
Thank you so much, DG Williams, for that warm welcome and substantial background. Andrea, I'd like to hand over to you now.
Thank you very much, Joanne, and thank you very much, DG, for the wonderful opening to this important day. It's been a privilege for us to work with you on this incredible project, which, as you say, we'll be looking through the data today to show how it is communications, which took us from the precipice of COVID to actually a new dawn of having navigated this huge health challenge and possibly using those lessons for other challenges we face as a society and a country. I am now screen sharing the presentation, and I will now start walking to the results. The way the presentations have been packaged for you today is that I will start off briefly with showing you how the research project was conceptualized, then looking at the communication and at this pandemic within the global context, because there are crucial lessons to have learned about how the global and how the systemic nature of societies has impacted us. Very briefly, how behavior change has moved and been affected between the last 2 years, and then doing a detailed look at the 2022 results. There are 6 components to what was measured in this project, and we'll be sharing you the top line results of each one of those sections. The most important thing about COVID-19 strategies, lockdown strategies, has been the societal shift. It's created an unprecedented global discussion around human rights and government accountability. And this was not a South African thing only. It was so across the globe, with governments for the first time ever being compared to each other on their performance. Since the onset of COVID-19, as Pumla just pointed out, government has been involved in social research to understand the awareness, perceptions, and behaviors around the lockdown strategies and the COVID impacts. The next two slides are impossible to read, but I'm giving it to you as a background to how the research dovetailed with the campaigns and the key events, as well as the rise of COVID cases. So, the research project. There were components that were specifically investigated and which I'll be giving you feedback on today. So the first wave of this particular study was done during May and June 2021. It was followed in November by detailed qualitative research. Because things were just changing so quickly, we had to understand qualitatively what it is that was impacting the research and that we had, and in fact, the people, the society around us. We then followed up with wave 2 this year. Now, before we look at the results, let's just share with you the GCIS segmentation of our citizens. There are 5 segments. Now, look at this slide and you will see that segment 1 and segment 3 are non-metro. The segments 2, 4, and 5 are more metro and urban. Now, if you just look at this, you can see firstly the big numbers. If you look at segment 1, 17.5 million citizens, that's the biggest segment. Right to the right, where cosmopolitan capitals are the smallest segment of 3 million individuals. Now imagine compiling communication strategies for 5 such diverse segments. It was a monstrous job, which ended up having been very well done. The respondent demographics had to reflect these 5 segments. So this gives you a quick overview of the actual respondents that completed the survey. It was very hard to get to the right respondents, but we couldn't let that hold us back. So we worked according to a Kish grid, which is the highest standard of sampling and places huge demands on the field workers, and they successfully concluded this. I'm also just sharing with you that research cannot be held back by physical constraints, except of course when you see them as here, where you literally cannot get to the respondent. Even then, there's a very scientific way of selecting a substitute respondent. So when you look at the results today, you can know that they have been compiled off the highest possible statistical standard. It is not anecdotal evidence which we're presenting to you today. Looking at the global context. So according to, it's called Our World in Data, which is a data source, 67% of the world's population have been vaccinated, 37% of South Africans. The difficulty which I'll be presenting to you today is the difference between social research and actual a tracking of behavior, such as vaccinated status and even infection numbers. Because of the stigma of COVID that entered societies worldwide, there's significant overclaim to these numbers. When you look at this slide, for example, you will see that South African infection rates appear to be significantly lower than those measured in developed economies. Now, we know that developed economies had daily, sometimes twice daily measurement of their societies. We couldn't possibly afford that in South Africa. One thus already sees the first inkling of trying to manage this pandemic with less resources. If you look at South African numbers of vaccinations, it's the 4th line from the bottom. And you can see that the only African country that achieved high vaccination rates, in fact, nearly double ours, is Botswana. So, as the World Health Organization noted over the last month or two, the challenge in communicating about COVID is that you need to communicate the risk or the danger whilst also building community trust. That's a very hard thing to balance. During COVID, let me just say, during the corona time of the last 2.5 years, everybody was learning. Governments were learning, citizens were learning, institutions were learning. In the process, there were some unintended consequences. From a behavioral perspective, behavioral psychology perspective, at Ask Africa, we're all psychologists, so we like to take this view on unprecedented and unexpected events. The unintended consequence was that compulsory vaccination actually increased levels of anger, especially amongst those who already mistrust authorities. And vaccine mandates energized anti-vaccine activism and reduced compliance with even other public health measures. So this indeed was hard to balance. The political and legal effects were profound. Socioeconomical effects of lockdown were profound. Even integrity of science and public health was questioned with a very dynamic response to the pandemic. So with the health regulations changing so swiftly, sometimes within days, citizens felt cognitive dissonance towards the government mandates. What does that mean? Citizens felt governments didn't know what they were doing. So this was felt globally, across the world. Conversely, some presidents of developed countries, which are often looked to as setting an example, started communicating very aggressively, which in turn increased distrust. I mean, having Emmanuel Macron, of the Prime Minister of France, even swearing about citizens is unheard of for a leader. For Justin Trudeau, the Prime Minister of Canada, saying, do we tolerate these people? You can hear the stigmatization. So it was a hard challenge for everybody. So it was quite clear that the way to manage vaccine acceptance globally was through trust. How do you build trust? Again, you actually build it by sharing the bad news, by being transparent about potentially negative effects. This is a lesson we learned through the corona time. It is not something that the leaders knew initially. In fact, even a effect was that conspiracy theories, which were exactly the theories which governments were fighting and health practitioners were fighting, were entrenched by the forceful implementation of policies in 2021. So rather than enhancing human agency and strengthening communities, many current vaccine policies actually work to disempower individuals. Now, remember very well, having repeated conversations with the Solidarity Fund in 2020, and they really drove this message of human agency. Also, corona restrictions were tested against the moral compass of human rights. There are 4 aspects to that we had to look at. How do forced mandates affect society? How proportional are the public health rules to ethical codes? A very hard thing to balance. Then human rights. How can the public perceive mandates to be ethically and legally clear if they violate established norms of informed consent and proportionality? Then how does, when stigma and segregation actually is normalized, how do we manage a society like that? To Pumla's earlier point, in South Africa, but worldwide, we are in a quandary of the war against women. Now, women were disproportionately affected by lockdown strategies for various reasons. Women often work in the low-paid jobs. In South Africa, we have the situation of domestic labor actually literally being locked out. So the economic lockdown which we followed in South Africa, which was also followed in developed countries, was done without being able to afford to really pay out those individuals initially at the start of it. And women didn't have the level of savings they needed to survive this. Women also bore the brunt of working from home when they also have children. This caused huge stress, and women could measurably be seen to be suffering from very high stress and trauma during the lockdown time. So the lockdowns have actually pushed back the gains of gender parity by decades. It's estimated that nearly 50 million additional women and girls have been pushed further into poverty, the gender poverty trap. 1 in 2 women reported that they or somebody they know experienced violence. We know what the South African statistics look like, and it's women and children. More than half of our citizens noticed an increase in domestic violence against children. So I was glad when Pumla raised this. We're very far from addressing this. So, looking at the results, look at this in 2021. The core message recall was still people over 60 getting registered first to be vaccinated, healthcare workers being vaccinated first, and people having to register. The awareness of the government's vaccine rollout plan was only half of our citizens. And please note this number, only 42% of the citizens were very willing to accept the vaccines. At that stage, we still thought that those willing to register for vaccines would be able to move into the very willing segment and then actually go and be vaccinated. It didn't happen. So the vaccine hesitancy reasons were low trust, and look at that, protecting themselves from contracting the virus. This is important in terms of the assumptions we had around Ubuntu when it started. Now look conversely at the Wave 22 core anchors. You can already see that we had numbers over 90% aware of the government communications around Corona and COVID, and 3/4 of our citizens agreeing that government is handling the pandemic fairly well, as well as the vaccination program. So this indicates a massive shift. When we look at recall, we could see that this is the number I quoted earlier, nearly 90% recalled information around it, and even around the specific messages of stay safe, masking, ventilation, and others. When we look at the specific campaigns, the recall was lower, simply, I believe, because of the branding of the campaigns. Citizens could not always recall exactly, was it now the stay safe, was it Vuma, what was it? So we could see that, interestingly and counterintuitively, the fear of side effects had actually increased between Wave 1 and Wave 2 from 23% to 52%. That shows you how dynamic this environment is, which we were functioning in. Now, with that introduction to the background, let's turn to the 2022 results. The first thing to note is that there were significant differences between provinces, especially Eastern Cape, that had the lowest levels of endorsement, and KZN having particularly poor results, which we'll go into. Limpopo had very high results. A neutral attitude of Northwest also, incidentally, reflected the highest levels of Ubuntu, which we saw in the Northwest. We saw from the start that the 65-year-olds plus had the most positive rankings on government, as well as the upper income. The rooted realists, remember the very first segment of government. So in a sense, the rooted realists and the cosmopolitan capitalists entirely on the left and the right gave government the best ratings. So there weren't that much of a significant difference between the geotype of metro and urban. The provinces look at Limpopo having the highest ratings and KwaZulu-Natal with only 65% of the ratings. Here already we can see that there's trouble on the horizon. So what then are the top 5 reasons for giving government good ratings? The very first reason is a communication. Now, that is amazing because the level of communication on COVID has been unprecedented. And it's good to see that that was very welcomed by our citizens. When we ask the converse question, why would you say was it rated badly? The first reason was corruption. And corruption really dented the government ratings on effectiveness and trust in unprecedented levels, really. So you can see that this corruption critique is strongest in the rooted realists, which is the 17 million we mentioned being the biggest citizen segment, as well as the cosmopolitan capitals, which was only 3% of our citizens. So what was the rating for handling the vaccination program? Well, the best or the driver of this high rating was free vaccines. When we look at the downside, it was having to travel to the vaccination site. And I remember Jane Simmons from the MRF being a huge proponent and alerting everybody to travel, making or denting the vaccination success. So that was very good from her side and from the MRF. But the travel actually created a stumbling block for our vaccination rollout. Now, this slide is fascinating. I mentioned to you earlier that the Solidarity Fund was very early saying, let's look at personal agency. In other words, how responsible am I as an individual for surviving Corona, as opposed to the community, the healthcare system, Department of Health, the President, the World Health Organization, or the government. Intriguingly, 50% personal agency. It was even higher at the beginning of Corona. It was in the 80s. So this is unheard of in a developing country. It is what you typically get in developed nations, but in a developing country where a lot of accountability usually rests with government, we could see that that has changed during Corona. This is just looking at the result from the different 5 segments, and you can see that it's largely the same. In fact, the highest personal agency is in the segment of rooted realists. Now, this is something to take note of because we so often think, speak, and plan for this segment as though they are left behind, they don't have resources, which in some ways, of course, is true. But we have to take note of the strong personal agency in this segment. So, the majority of South Africans feel that the government is handling the pandemic well. KZN, though, is very negative towards the government efforts. The level of trust is very low. The main reason government was rated as doing a good job was because of the communication efforts, because of the education efforts. That curve has flattened, or the corona curve flattened because of this. 75% of South Africans feel that government handled it well. Older age groups in particularly also looked at that. So I think all in all, when you look at the 2022 results, it's a good result. Let me look into some of the detail. The question was always, how do we communicate? This slide 2 gives you a view of the number of platforms that had to be managed by the GCIS in communicating on corona. The most effective platforms were TV, radio, and word of mouth. You can see that some of the platforms that were added in this year of SMS, church posters, workplace posters, pamphlets, etc., also achieved a good result. Sorry, just on this slide, it is impossible to now say, let's only invest in TV, radio, and word of mouth, because this result differs in the segments and the actual communities. The takeout here is that the awareness is relatively high and it has to be maintained. A massive behavior change, a behavior change in a year, in 2 years, is unheard of across the world. Have we ever had a behavior change on any other topic like this? No. So the success is unheard of. Let's retain that success and apply it to other areas. Let's look at vaccine messaging. You can see that the awareness of the vaccinations has improved drastically. It's tripled between 21 and 22. That again it's a sterling result. We can look at it in different regions, but essentially you can see that Eastern Cape and Limpopo and Mpumalanga had the lowest levels of awareness. So what was the awareness about? It was protecting yourself and your friends. Messages seen, this is just the detail around the messages. Again, the platforms on vaccination were...
communication. They are the successes. Why is it missing?
The platforms on vaccination that worked for vaccination communication and corona communication are exactly the same. So in summary, 71% of South Africans said they'd heard or seen a lot about COVID vaccination. This is amazing. This is excellent. The most recalled messages are protect yourself, protect your friends, and vaccines are safe. And then the platforms were TV, radio, and word of mouth. So let's look at the actual campaign recall. There were lots of campaigns. The campaigns had lots of different names. You will have seen many or some of these. When we tested the spontaneous recall on this initiative, the Stay Safe had the highest recall, 36%, followed by some of the others. Now, the reason I'm sharing this with you is simply because of a learning. A learning was that in a citizen's mind, he or she won't necessarily associate the message with it was a Stay Safe campaign, it was a I Choose Vaccination campaign, and it doesn't really matter. In fact, chances are we would benefit from driving the message more than the name or the branded campaign. That was a lesson learned. But the impact was that citizens could recall the required behavior change. Across the board, it is quite clear that cosmopolitan capitals were following the pandemic and the lockdown rules more than any other segment, and they were also more likely to vaccinate than any of the other segments. The Roll Up Your Sleeve campaign got the highest ratings from metro mobiles and cosmopolitan capitals. Again, you can't predict who's going, or we weren't able to predict before who would hear which message. And that's what makes it so important to maintain the intensity of messaging, the platforms, and the timing of the messaging. The spontaneous awareness was, again, low, one would say. 41% couldn't name a specific campaign. However, they could name the desired behavior change. And that's what we're actually after. So, the point of this section is that the name of the campaign doesn't matter, whether it's spontaneously or with aided awareness. What matters is the behavior change. So in future, one might actually be want to balance the number of campaigns and the fragmentation of those campaigns. It's a very hard call, though, because you are hoping to get to every part of the country, every part of the segment. So let's look at the effectiveness of the communication and trust. This is, again, one of the most intriguing parts of this research from my perspective. So when we asked who's communicated most effectively, government across, whether it was on safety measures or vaccinations, government got a sky-high rating, 75%. The only complete outlier to this result is KZN. They rated 20% less. They gave a rating of 52%. So something's brewing there. Independent health experts have remained the most trusted communicators since 2020. The trust of information sources. This slide is something which you would want to look at in more detail later. We looked at the polarities, so complete trust and complete distrust. And you can see across the board in KZN that trust is an issue. Regardless of the communicator, there's very low level of trust. That is a huge concern for a society that needs to pull together and be mobilized to deal with crises. So significant work needs to be done in the KZN regarding social capital and trust of institutions and structures. So, what is it I want to highlight here? The study was, I started off with saying the sampling was very detailed and addressed all pockets of society, of provinces, of demographic features. It's necessary to maintain it on that level in order to be able to respond. Trust was a key factor in creating effective messaging. And this trust is there on a higher level of government rather than on a local or close source. Even the trust in the communities has unfortunately decreased over Corona. Now let's look at preventative measures that were implemented. They were very high. The washing of hands with soap frequently is still a daily habit or frequent habit. Using sanitizer, social distancing when you're ill, and even in other situations as well. So I want you to look at the text on the right-hand side, simply because this text you will have heard anecdotally. You will have heard, or I certainly did, I heard a lot of this from just asking, obsessively asking in communities I visited. Now, I drink a mixture of spirit, liana, lemon, and disprin. I drink garlic and lemon. I eat more vegetables. Ivermectin. The reason we didn't get this, I believe, in the statistical questionnaire is because of the social stigma, which we need to be aware of around corona. The actual vaccination uptake corresponded nearly exactly to the very willing segment of being willing to vaccinate, which we've had since 2020. Now, this is an intriguing thing, and it reflects really the level of vaccination stigma, the difficulty of having communicated, and many things, the whole boiling nature around corona that we've lived with over the last 3 years. The booster vaccination uptake is low, and this we will see on the next few slides is possibly a result of low institutional trust. We could see that regardless whether a citizen was highly informed or not, they had the same booster uptake behaviors. So this then reflects to trust. We could also see that between 2021 and 2022, the worry about side effects doubled. This can only be a result of social media and other information, as well as lack of trust in formal structures. So this is something we will have to continue working on. Again, when we look at the study of Morning Consult, it seems that the vaccine, well, it's just an interesting source. So let me share it with you. Who were the people that were unwilling to get vaccinated? Russia, nearly a quarter. Germany, Canada, France, 10%. In South Africa, we had 42%. So it's an interesting situation. Vaccine hesitancy globally suggested that vaccine hesitancy had to deal with the lack of trust. So how do we build that as communicators in a situation where the world over people felt lied to, unheard, and pushed aside, which means stigmatized? So it's a global governance challenge which we have. So the trust in the communication about the vaccine and the vaccination program was actually very high. This is a very high level of trust. Then when we look at the agreement and statements, should government partner? Again, there was a huge increase in those statements, which is new, which is wonderful. So there's support for government and business teaming up to deal with this issue. So, in summary, we have that the most preventative measures are still actively followed. We can see that 67% say they have been jabbed, even though we know that the facts are that it's 37%. We need to, as researchers, as scientists, as communicators, be very aware of that overclaim, simply because it indicates stigmatization. The main reason for not being vaccinated is still the worry about side effects. Trust is the biggest obstacle to getting vaccinated. So reassuring and building our institutions is critical. Most South Africans agree, 85% agree, that the administration of the vaccine is most effectively done by government and teaming up with business. So, very high levels of trust in government, very high levels of partnering with business. The lesser known facts around the safety of people with comorbidities are still influencing the booster shot. Then having access to venues, again, that point earlier about having to travel to venues is something that we need to plan for differently and on board. I'm now turning to my final slide, the closing thoughts on all the research done over the last 2.5 years. The communication program was a significant success. The data suggests that this communication competency is respected, appreciated, and trusted. It stands to reason that this is a primary asset in our country, and we should give it more muscle to possibly apply to other topics, such as whether it's HIV/AIDS, whether it's tuberculosis, whether it's diabetes, or GBV, or our national values. So this primary asset I am completely thrilled about, because it enables us to move to other platforms. COVID fatigue is real. So the more communication on COVID has really given us inconsequential behavioral results on the booster shots. So the communication content should probably now move to personal hygiene or others. Public trust and Ubuntu have been decimated by the COVID-19 lockdown strategies. Citizens are left with little or no trusted support structure. The breakdown in trust and social capital is something we must attend to. When we measured Ubuntu in 2020, it was very high. In fact, we could see a direct statistical link to those provinces or segments with high Ubuntu and emotional coping mechanisms, having a sense of we managing, we coping. The levels of supporting each other financially initially were also very high, but then resources ran out and it became more difficult. We thus need to take a fresh look at Ubuntu. What does it look like in South Africa where resources are so thin? A subsequence of this are very high levels of personal agencies. So citizens have started saying, I have to only count on myself. I don't have a community I can rely on. This sense of personal agency normally is found in developed economies that can rely on themselves because they work in a predictable social context. So this is a significant societal shift in our democracy. The social desirability responses to surveys have increased dramatically on topics which were not considered to carry stigma before. By implication, our research needs to be done on stigma in our society to prevent overclaim figures. It's impossible to base a strategy on data where we suspect there's huge overclaim. There are 3 public institutions which need to be bolstered in particular in order to prepare us for future public health crises. The scientific fraternity, because there's such high levels of trust, the legal fraternity, because the legality of measures and human rights was brought to the fore, then the leadership fraternity, who communicates, what's the role of leaders, what should they be doing? Then finally, the final point is that citizen support for government partnering with the private sector has increased substantially. This is a new model of delivery, which again could be a big asset. And I want to thank you for the time today. The project was excellent. It's very clear feedback on what the GCIS was able to achieve over the last few years. Thank you.
Thank you so much, Andrea. That is indeed a very interesting and very insightful presentation. I'm sure everybody is very curious to ask a couple of questions, but I'm going to ask them to place them in the chat until we've had time to hear from our next panelist. Thandeka Rabashakha has agreed to join us today. Unfortunately, Wendy Clove from the Solidarity Fund has been struck down by illness, and we hope it's nothing serious. So Thandeka will be joining us today, and she is one of government's strong partners from the Solidarity Fund. And particularly looking at the results that Andrea has pointed out, that partnership has enabled government to achieve much more than it would have going it alone. And I like to hand over then to Thandeka to give us her experience of the benefits of partnership. Thank you, Thandeka.
Thank you, Joanne, and good morning to everybody. I think initially, just from the onset for the Solidarity Fund, it was very important. We knew that we needed to conduct research and we needed to actually partner with the government in terms of conducting research and understanding attitudes, understanding behaviors and perceptions with regards to the COVID-19 pandemic itself, and then later on the vaccine rollout. So from the onset, really, the fund really expended a large amount of financial resources in year one to respond to the COVID-19 pandemic. But despite the extensive public health communication campaigns, we needed to understand what were the required behavioral changes that needed to be embedded in the communities. It was also important to understand the attitudes so that you can guide and plan communication messaging and future campaigns strategically. So then we sort of moved over to the vaccine rollout, and initially it was sort of envisaged that the rollout of the vaccination would have limited success amidst high levels of vaccine hesitancy. So there it was so important for us to understand the reasons for this and enable the appropriate interventions. So Solidarity Fund and GCIS jointly funded research programs, and these really enabled a deeper understanding of attitudes, perceptions, behaviors, and to ensure that we really roll out evidence-based interventions, which really encourage and are impactful in terms of behavior change via the different and many campaigns that we then rolled out, including the vaccination rollout. So the amount of funds that were expanded from the Solidarity Fund was 2 million, and GCIS also committed 2 million. We rolled out two phases, two-pronged approaches. We had a phase one, which was quantitative, and that happened towards between March and April of 2021. And here it was basically just assessing the awareness of the COVID-19 communication across various media channels. We also wanted to find out and assess what the public perceptions of COVID-19 pandemic were at that time in terms of trustworthiness, in terms of believability, in terms of reliability. We also wanted to assess and understand the vaccine. What do people think about the vaccine rollout plan? And we also wanted to assess key messaging and recall and takeout. Were people actually, did they remember the messages? Were they effective? And then we also wanted to find out attitudes towards vaccine acceptance or readiness, especially as there was a lot of misinformation or disinformation at that particular time. Our phase two research partnership with GCIS had to do with qualitative research, and this was during the vaccine rollout program. We wanted to find out and have an in-depth understanding of underlying factors for slow vaccine uptake during the vaccine rollout program. So we did Ask Africa through GCIS conducted this ethnographic research. It was qualitative with really the endpoint of just understanding or observing or interacting with participants in their real life environments and finding out their perceptions and understandings towards the vaccination program. So the partnership has really been beneficial in terms of guiding communication for the Solidarity Fund. We knew already that broadcast outlets were critical, but through research, we understood that a multimedia approach was necessary to reach all the community segments adequately. We also found out through the research that it was important to get vaccines into arms by addressing the barriers. Andrea spoke a lot about how people had issues or the biggest sort of challenges were side effects. And we were able to then shift or align our communication messaging to really talk about the different side effects, whether it was sexual reproduction, whether people had issues with pregnancy, or just health side effects. And that's how, you know, this partnership was able to guide that sort of information strategy and messaging. Through the research, we found out that communication should continue to enhance public trust around the COVID-19 vaccination, and also that we needed to really change, especially from the first quantitative research to the qualitative research. We found that local level mobilization and education was very important. So we rolled out very focused and intensified communication campaigns. And we did that also through our partnerships with the civil societies. And also, as Andrea pointed out, we also found that using doctors and nurses to encourage people to vaccinate was most beneficial. Our essays asking digital campaign that we ran on our different social media campaigns was one of the biggest, you know, we got one of the most biggest impressions on that. And we had used the medical doctors to just answer questions from regular South African citizens around the vaccinations, around the side effects. And what we're able to do is also translate that into various languages, which we found was very effective. So really the partnership benefits allowed for insights, for focused communication, for specific target audiences and geographies. We were able to have informed insights from citizens. We were able to better campaign agility and relevance, and also the ability to upweigh or downweigh campaign mechanics to suit the audiences. And then also our partnerships, as I spoke about earlier, with the different civil societies to better reach the communities on the ground and to have different targeted focuses. SACC really ran great faith meets science dialogues, which they started after, you know, through receiving research outcomes on to say that, you know, the religious community has different hesitancies or misinformation around the vaccine, and how do we really address that? And they came up with this great faith meets science dialogue campaign that they ran in the different districts, especially focusing on those with low vaccine uptake. And also were able to reduce duplication amongst the partners so that our results were better focused. And also identify the close gap between intention and action and to break that inertia. So really the research that was funded and spaced over time, allowing for messaging adjustment and also depending on communication needs and pandemic management was really beneficial to the fund in terms of then us being able to work with our partner, our communication partner at that time, and Joe Public was running our campaigns to really refocus on strategies that would work based on the research that was found. Thanks.
Thank you so much, Thandeka. It's wonderful to hear from the other side of the partnership. I know GCIS benefited not only from the funding, but also from the shared insights. And we benefited a lot from the National Communication Partnership, in which you also participated as an organization. Colleagues and ladies and gentlemen who are joining us, I'd like to hand over now for the open portion of our webinar today, where you're welcome to raise questions and to engage in discussion with our panelists. I'm going to hand over to Ms. Tasneem Karim. She is the Chief Director for Policy and Research at the GCIS, and she is going to moderate our discussions and take us through the last items on the program. So Tasneem, if I could hand over to you.
Thank you very much, Joanne, and good morning to everyone. I was watching the chat and I see we've already had one question from Faith Kumalo asking for a recap of the sampling and methodology. And Mariette has responded already, saying that it was a nationally representative sampling with 1,500 participants, which was inclusive of all the key demographics, provinces, and the government segmentation model. Therefore, we could make good conclusions about South Africans aged 18 and older. And then I think Letitia was just adding that it was robust enough to ensure representativeness. I don't know if Faith is happy. And I think we can always take it offline if she wants some more details. But for now, let me open to anybody, I think, that wants to say something, a question or maybe a comment. And I hope that the host has enabled it for attendees to be able to raise their hands. You're welcome to also post something on the Q&A section.
Tasneem, we can maybe note Okuhle Hlati raised a hand right at the beginning of the webinar today. And at the time, we were closed for verbal comments. So I'm not sure whether Okuhle Hlati, if you'd like to voice your question now.
I don't see Okuhle here, but oh yeah, I do see Okuhle. Would you like to make your comment now? Okay, it seems not. Let's see, Faith, over to you, please.
Good day. I hope you can hear me.
Yes, we can. Please proceed.
Excellent. Thank you so much. We really just want, from my side, to express our appreciation for these webinars. It's the second one that I'm attending, hosted by the GCIS. And they've been very helpful. There are 2 points. I mean, I think the first one is around KwaZulu-Natal. The presenter repeated, on more than one occasion that KwaZulu-Natal is an outlier. Are there any thoughts with respect to what could be the drivers of what we're finding, where it seems that, levels of trust are low and several other factors that are different to what other provinces are showing. And then secondly is that I think it's extremely pleasing, and I think other colleagues have also made comments in the chat, that government and the officials, health experts, and in particular the Minister of Health, as well as our president, are rated so highly by our people. I think if you are saying we can generalize, or we say generally in South Africans, in terms of being a credible source of accurate information. This is also in line with the research, I think, that was recently concluded by the HSRC that we're doing on behalf of the Department of Social Development, looking at known youth and the impact of COVID-19 on them. And even in that sample, government is the source of data credible information also came up quite highly. And so I think there are lessons there for us, and I'm sure GCIS would have a view about how we leverage on this when we deal with other matters that are pressing in our society, you know, including issues of alcohol and drug use, monkeypox coming up, and many other matters that are of priority for all of us, that we really do make use of the available resources internally within the various government departments and other structures to be much more present in the media in the way that we were during COVID-19. And I say we were because I work in the Department of Basic Education. Thank you very much for the opportunity.
Thank you very much, Faith.
Andrea, it looks like you want to add.
Yes, maybe, Faith, thank you very much for that question. Now, I don't like answering a question if I don't have clear data, but what I can tell you is that what you're pointing out about the trust in our president, we've seen that from the beginning of COVID. So with his frequent feedback to our country, he built very high levels, the highest levels of trust. And we could see quite clearly from looking at the research in 2020 that there was a very close correlation between trusting the president and changing behavior and actually implementing this behavior change, which everybody was asking for. So that is the bedrock of any social change, is the leadership, trust, and reputation. Now, what we did see in this data as well was that the primary driver of mistrust was corruption. And that, yes, that affected all implementation asked for on Corona. On KZN specifically, I would only say that the leadership principles which Harvard or anybody else will talk to is that when there's unpredictable leadership and a leadership vacuum, it builds immediate distrust and lack of support for even the basic things that need to be done. So I think given the turbulence of that region, it very clearly shows that nearly the citizenship of that region is stepping away from any kind of functional engagement with the various government structures. So that was quite a shock to me actually to see the data on that. And I think it most certainly requires a study, because I just went into that slide and one could see that it's not just government. In fact, it's the leadership doubt has split right through to traditional leaders. So it's a very difficult situation to want to address in the KZN. I hope that was helpful.
Yes, thank you, Andrea. Thanks very much for that response. And thank you to Faith for the comments. And I think the one point that has not come up is about campaigns that are properly resourced. Because when you have a campaign such as, well, COVID, we can't even say it was properly resourced, but it was resourced a little bit better than some of the other very critical campaigns that we do run. And you could see the difference in that early on, the message recall and spontaneous message recall was quite evident. So I think that's also one other factor, along with some of the factors that have been mentioned. Can we also just say to all the attendees, we've got a question from Puti Mabelebele. which has already on the chat, which has already been responded to by Mariette from Ask Africa, our service provider. And the question that Puti raised was about persons with disabilities. And I think that while Mariette has responded about the survey, can I just also add that in terms of rolling out the strategy, certainly government communication went all out in ensuring that we do not marginalize people with disabilities and made extra effort to ensure that we always have a sign language interpreter at all broadcast TV opportunities, all media briefings. We made sure that there were sign language interpreters. We also made sure that the government newspaper is translated into Braille and distributed in societies of the blind all over the country. And so there are efforts to ensure that people with disabilities are included. So I think that is covered. Also, Fezani Kumalo asks the question, is there a need for a change in communication strategy? I think the answer to that, Fezani, is that there's been continuous change. We've, right in the beginning, in phase 1, we picked up, for example, the reasons for people to adhere to safety protocols, and we adjusted the messaging immediately. And people, for example, people were saying that the reason they are washing their hands and wearing their masks and staying home is because they want to protect themselves and their families and friends. And that's how we changed the messaging so that it spoke directly to that. We also, together with our partners, we also ran a qualitative project. We discovered that there were significant barriers to vaccination, which we took to the Department of Health and together tried to find some solutions. So there's continuous change as we find, the research is showing us that some of our messaging or some of our methods need adjustment. We do so on a continuous basis. And that's why our output is always informed by science. So the presentation, Fezani is also asking for the presentation to be shared, and I think that is totally in order. Andrea and Tandika, can I just say that many of the participants are showing thumbs up and expressing gratitude for the presentation, and I think it's giving us a lot of new perspectives. So I'm just going to give it another 3 seconds to see if there's anybody else that would like to say anything, either on the chat or using audio. Otherwise, I think we should move towards closure because we would be well in time. So it's my task to bring this webinar to a close. And I want to say that I think we've had a fantastic research knowledge sharing session. These insights and discussions do indeed enable us to take forward our learnings and our best practice. Thank you to our DG for always supporting our work, and to both our presenters for your genuine contribution. To the CEO of Ask Africa, Andrea Rademeyer, thank you to you and your team for all your hard work. It shows your passion in telling the South African story. It also ensures that we leave no one behind as we take on the views of South Africans to improve our communications. Also to the Solidarity Fund rep, Tandika Raboshaka. Thank you to you and your team for your investment in the GCIS. Thank you for working so well with us and investing in our expertise so that we could together keep our finger on the pulse of public perception. And when we needed to, we could be brave enough to amend our strategies. This partnership went beyond simply sharing of information and resources to developing a kind of comradeship. Without our joint energy and efforts in addressing this pandemic, we would never have been able to minimize the devastating impact of COVID-19 as we did. So this knowledge is critical as we progress from the COVID-19 chapter to our new chapter of rebuilding our country through the South African Economic Reconstruction and Recovery Plan. And though the insights from conversations with South Africans ensures that we heed the call of the president to leave no one behind. This will also have some implications for some of the critical issues that were raised earlier by Andrea and by our DG, relating to corruption, relating to GBV in South Africa and some of the other challenges that we face, joblessness, inequality, and so on. But we have to thank our partners in where we've come so far, and we think a partnership like this will take us much, much further. Indeed, our journey to realizing an end to the national state of disaster on the 5th of April would not have been possible without the commitment and the dedication of our partners. We can only go from strength to strength if we continue to collaborate in our journey. Our learnings have empowered us with insights on partnerships, social and behavior change communication, as well as the preferences of platforms by South Africans. So it's helped us with also further developing our segmentation model, and it moves indeed from strength to strength. Also, our research has taken us a long way in making sure that we remain interactive with citizens, institutions, communities, and stakeholders as part of an inclusive program of information dissemination and behavior change. I also want to thank the DG for complementing our team, the joint team, and I can confirm that I too am very proud of this women-led team of experts. We've built this team so that they are more than competent in standing their own ground in, I'm sure we will agree, a very patriarchal world. So lastly, a big thank you to the participants for partnering with GCIS to make this research knowledge session possible. Partnerships such as these are a critical determinant of success in our country. And as Faith said earlier, we all learn a lot. So we intend to continue having more and on more topics in the future. So please watch this space. But we each must do our part to also making sure that we contribute to being part of the solution that guides our country on its developmental journey, so that we indeed, as the president says, leave no one behind. Thank you to all the teams who worked behind the scenes for bringing us together. And thank you for the more than 100 participants who they were able to bring to the party today. I trust and know that you will take today's learnings and use it to enrich your work. So wishing you all a productive day further. The session is now closed. Thank you very much for joining us and have a good day further. Bye-bye.
Thanks, Tasneem.
Bye.